It's my privilege on behalf of my co-authors to share our experience with a passive data collection paradigm across the episode of care. Each of us has a relationship with Zimmer Biomet which is directly relevant to the content of the study. Our purpose was to determine the feasibility of passive commercial data collection and analytics derived from an integrated digital ecosystem across the episode of care, and to determine how intraoperative parameters may influence early functional outcomes. 3 key elements were necessary for patients to be included in the study. First, patients need to have had surgery with assistance of the ROSA knee robotic system, so intraoperative data points could be collected, including surgical times, component alignment, limb alignment, and medial and lateral laxity measures in both flexion and extension. Second, patients needed to be engaged with the MyMobility care management platform, so perioperative data, including step counts and Kuss Jr. scores, could be analyzed through the entire episode of care, and analytics were performed using the OrthoIntel and ZBEdge integrated platform. 131 patients were thus included in the study. Kuss Jr. scores improved significantly over the 6-week postoperative course, and step counts initially decreased but then returned to baseline by 6 weeks postoperatively. At the termination of the case, there was no difference in laxity measures between the medial and lateral compartments in extension, and while there was a 0.2 of a millimeter difference in flexion laxity between the compartments, this was likely not clinically relevant or significant. Patients who had less than 1 millimeter of medial laxity in flexion had significantly fewer step counts at week 6, but otherwise we found no differences in functional outcomes in patients who had less than 1 millimeter of laxity or more than 2 millimeters of laxity in each compartment in both flexion and extension. Unfortunately, we were underpowered to determine the impact of far outliers on functional outcomes. So in conclusion, passive data collection from a smartphone-based care management platform and robotic-assisted surgery across the episode of care is indeed feasible, and we observed associations between intraoperative measures of laxity and postoperative outcomes. This study highlights the value of integrating a digital ecosystem that includes information collected intraoperatively using the robotic technology and perioperatively using a smartphone-based care management platform. This contemporary data and analytics platform has the potential to improve the understanding of individual recovery pathways, guide individualized care and surgical decisions, and ultimately maybe inform artificial intelligence algorithms. Thank you very much.